I am Dr. Rahi Victory, and welcome to Fertility Fact or Fiction, where we try and dispel all the myths and give you all the truth about everything fertility. I am here with my good friend Tariq Ibrahim from Ibrahim Strategies Group, and we do not have a particular topic tonight because there really wasn't any great science that had been released in recent times. So we're just going to answer your questions tonight, and hopefully we can all get home and watch 1883 or some fun show like that. If you haven't watched Yellowstone yet, you should. It's a great show. And 1883 is the precursor show to Yellowstone. So I'm a huge fan. Oh, you haven't seen that yet?
No.
Oh, it's a good show. You got to watch it. Anyway, so back to the topic at hand, which is fertility. We're going to take your questions right off the bat, and people have been asking them all day. Also wanted to just have a huge shout out for all the people that have followed us on YouTube and watched our video on using Viagra for female orgasm. It's kind of going viral. We got about close to 20,000 views now in just like 10 days. So thanks for watching that. And if you haven't checked out our YouTube channel, definitely go there. Make sure you subscribe and push that notifications button. All right, so you got the questions? All right, fire away. I'm ready.
First question.
Drum
Seems like a newbie.
A newbie, okay.
Yeah. How successful is IVF?
Oh, well, IVF is very dependent on you. So if the sperm is good and the eggs are good and you're young and healthy, we're seeing success rates in excess of 80%. If you're much older or the sperm is compromised or there are complications like genetic problems or endometriosis, your success rates can go down. So, kind of the lowest we'll see is about 10 or 15% success. And those are really for very complicated patients. And the highest we see, for example, with our egg donor program is pretty close to 100%. So it's very dependent on what we're getting and what the quality of the material that's going into it is. It also very much depends on where you go. There are centers that can get you a 30% success rate, and then there are centers that can get you a 70-80% success rate with the same sperm and eggs. So it really makes a huge difference as to which place you go to. We have lots of people coming to us because they failed in other places. We're kind of the go-to when they're having trouble that other people can't resolve. And then we're getting success even though they failed previously in other centers. So it's a great question, but it's tough to answer because I need to know so much more about you before I can get you a reasonable, realistic figure of, what to expect.
Dr. Victory, it was a pleasure to see you at Downtown Create. I followed your instructions and transferred when my progesterone levels were low, and I am now pregnant.
Oh, amazing. That's great. Well, congratulations. I'm glad to hear that worked. And I'm really glad that you listened to our advice. We have a load of people where we get messages pretty much every day from people that said, hey, I watched your show, or we, listened to what you said and we tried it and we're now successful. And I think we're really happy about that because the purpose of this show was not to attract more clients for us. It was to help people. And that's kind of how we've built our practice. And so we're super excited when we hear that just watching the show has helped people, because that's like the best reward in and of itself for doing all this. And Tariq and I kind of put our heart and souls in our stomach right before the show into this every week. So it's a lot of effort, but and a lot of time, but we love doing it. So I'm glad that it's paying dividends for people watching. So congratulations, lots of thumbs up and likes for you. So that's wonderful. Good news.
Can you please explain the controversy on PGT testing? Why is it that some don't believe?
Yeah, so PGT testing is testing where we check to see if your embryos are normal prior to actually implanting them into you. So the process requires that we actually first go in and grow the embryos, and then we have to laser hatch them, and then you got to let part of the embryo kind of hatch out, the part that's becoming the placenta. It's called trophectoderm. And it'll kind of bulge out of the embryo. And then once it's bulged out of the embryo, you can take the laser and kind of shave off a piece of it. And then you still have to kind of tear it off. And that's the tissue that gets sent to be assessed to tell us if it's genetically normal or not. So the reason that it's controversial is that it has never been shown to be beneficial in women that are less than the age of 38. And the reason for that is we know that up to that age, depending on how old you are, the range of ratio that you will get will be anywhere from about 20-25% if you're really young that the embryo is abnormal, up to a high of like 60-65% at 38. So you're really dealing with a pretty wide range. And if you're in that middle, like 30 to 35 or 28 to 35, your chances are anywhere from like that 25-30% to 50% range. So if your chances are 50-50 at worst, they're still pretty good, and you're going to most likely not need it, because whether you do it or you don't, you got a 50-50 chance either way, and so it's fine. Once you get older and the ratio starts to favor that the embryos will be not normal, it's a different story, because you don't want to go through 5 different embryo transfers to find one embryo that's normal, if you're in a percentage where only 20% of the embryos are normal. So in that instance, it's actually not a bad idea to do it, because you're going to be able to narrow down which embryos are going to give you a better result. Now, every day there's new studies coming out, and it's still quite controversial. The best study, I believe, is one called the STAR trial, which was like a real world study of the application of this. And it did not show a benefit unless the patients were older. So based on that, we don't push people to do it unless they've had previous unexplained failures, they've got recurrent implantation failure or pregnancy loss, they obviously have a known chromosomal or genetic abnormality, or for whatever reason, they're just very morally or ethically or spiritually, religiously, whatever, committed to not terminating a pregnancy and very much want to avoid a pregnancy that's abnormal. Otherwise, we don't normally tell our patients under the age of 38 to do it. Sometimes we do, but most of the time we do not. We tend to favor not doing it and just doing it for women that are older than the age of 38. In the older than 38 category, we try and do it more or less universally. And actually, we were just renegotiating pricing with our colleagues, Cooper Genomics, which are the largest in the world. So we got their price down a little bit better than what we had before to help you guys out. So I'm kind of excited about that. We just found that out today, actually. So we'll have something new and less expensive to offer, which is great, because most places only know how to make the prices go up, and we're actually trying to make your prices go down. So welcome to VRC.
I like that. I have endometriosis.
Okay.
Can it cause fertility and a fibroid, a tumor on my uterus?
So endometriosis is a 50% reduction in your fertility, and the more severe it is, the more it can compromise things. Fibroids can interfere with your fertility, but it depends on how big it is, where it is it pushing on the inside of the uterus, is on the outside of the uterus, and so on. So fibroids can be kind of hit and miss, but endometriosis will reduce your chances quite significantly. And there are different ways to manage cases with endo. And actually, I think that's one of the things where one of the areas where we do best in is managing the cases with endo, because a lot of places just keep transferring embryos in, hoping it'll work, but you really need an endo protocol if you're going to deal with patients that have endo. So we do a very good job with that. Supplements, traditional Chinese medicine, naturopathy, hormonal suppression, freeze-all cycles. Like, there's a whole protocol for us. Sometimes we even use an immune protocol to kind of get the best results we can. Actually, just today when I was reviewing articles for the show earlier in the day, or for next week's show, I found an article looking at some kind of traditional Chinese medicine compound that they claimed improved the chances specifically for patients with endo. So if you guys are interested, throw some thumbs up and we may go off after that and try it out.
I am 31, have an AMH of 11. Is that good or bad? FSH is 5.5. How can I increase my AMH?
So vitamin D will increase your AMH, healthy living, weight reduction sometimes if that's a problem, exercise, that kind of thing. But it's going to be like a small notch up. You can't go from like an 11 to a 20. You might go from like an 11 to a 13 or a 14. So those are the basic things that work. DHEA may assist you as well. It's a hormone that kind of strengthens the ovaries. So there are some various options for what you can do to help improve the chances of success and to increase your AMH level. But by and large, an 11 would be normal to slightly low at 31 if we're talking about picomoles per mil. If you're talking about, or sorry, picomoles per liter. If we're talking about nanograms per mil, your AMH is extraordinarily high. And so it depends on what units you're using, but I'm guessing that you're using picomoles per liter. So if that's correct, you're in the low end of normal to just slightly low for someone that's 31. But you still have lots of time. And with an AMH of 11, I certainly wouldn't worry about getting you pregnant. You should have very, very good opportunity.
Tips and tricks for dealing with early pregnancy nausea.
Diclectin, which is doxylamine, succinate, and vitamin B6 and pyridoxine and stuff like that. So they put them all in together, and that works very, very well. We start with 2 tablets 3 times a day. Try small meals more frequently. That also helps. And then, if you need something stronger, ginger, Gravol with ginger, those are fine as well. There's no harm from taking Gravol in pregnancy. For those that are really debilitated, you need to take stronger anti-nauseants. So any of those things will be reasonable to try. Most people find that if they kind of keep their stomach full, they tend to get less vomiting, but you can gain a lot of weight doing that. So you got to be careful with what you're eating.
Part 1 of 4 comments.
Part 1 of 4 comments.
Yeah, so get ready.
All right. Wow, go slow.
Yeah.
I'm old now, man.
Don't worry. I'll go slow. Should you stop blood thinners if you have SCH?
Yes.
I had a significant bleed yesterday with large clots and assumed I was miscarrying. Had an ultrasound today. This is part 2. Had an ultrasound today, and baby is measuring right on track at 7 weeks, 1 day with a heartbeat of 143.
Awesome. Congratulations.
Part 3. I have 2 SCH measuring at 1.8 and 0.8 centimeters. I am on ASA and Fragmin daily. Fragmin was added to this protocol because of a history of implantation failure and miscarriages. Okay, part 4. LOL. Sorry. Would you stop ASA, Fragmin, or both, or have patience and continue as normal?
No, I would stop. I mean, those are small bleeds, but if you bled bright red, I would stop for a little while. You can always go back, but you will potentially expand the bleed if you continue. So most of us would recommend stopping for a little while, letting your body catch up, and then go back. If you're really worried, probably stop the Fragmin, stay on the aspirin, which has much less of an anticoagulant effect than the Fragmin does. But we would normally stop both until your bleeding settled, ultrasound to make sure the subchorionic hemorrhage has gone away, and then restart it once it's gone.
Hello, Dr. Victory.
Good question, by the way. Hello.
Thank you for taking your time each week to answer all our questions.
My pleasure.
My day 21 progesterone is a normal cycle, is around 65.
Okay.
My doctor wants to put me on 800 milligrams of progesterone and Overdrill booster for my FET. The last time I done this, my progesterone peaked at 400 and the embryo did not implant.
Whoa.
Can progesterone be too high?
Yes. I mean, that's birth control. You can't let your progesterone go anywhere close to that high. Your peak is 100. Sometimes we can let it go over as long as we correct it, but that's why we check our progesterone levels so carefully, because for the ones that are too high, we bring it down and recheck it carefully, even if we have to daily until we get it right. So that no one should be transferred with a progesterone level of 400. That's way too elevated. So yes, don't do that. Make sure they're checking you very, very carefully and your progesterone level definitely can be too high. At that level, it's so hyperprogestinized, nothing's going to stick. So you're really on birth control at that point. And thank you for saying thank you about the show. I think it's important we send a huge shout out to Tarek's family, who puts up with him spending all this time with me, and his 5 lovely children and his lovely wife, and my wife and my kids who are scattered to the winds, but my wife is not. And so thank you, Wendy. I love you, and I appreciate the fact that you put up with Tarek and me having bro time every Monday night.
Well, it's never going to let me back here now. She knows it's bro time. I thought I was working here.
Yeah, Tarek says his wife's never going to let him back in because now she knows it's bro time. It is kind of bro time. We have a good time.
It's a good time.
Yep.
Thoughts on doing an NT scan? I heard a lot of people get false positives.
So this is a great question, and let's all kind of gather in close for this one because this is really important to understand. So NT scans, which is nuchal translucency, it's the thickness of the back of the baby's neck, is a marker of Down syndrome. But it is not a yes-no phenomenon. It's only going to help you as part of something called early first trimester screening, estimate what your risk of having a baby with Down syndrome or trisomy 13 or 18 is. So it's not going to tell you yes or no. It's going to give you a chance. And your chance is going to be like 1 in 300 or 1 in 8 or 1 in 20,000 or less than 1 in 20,000. And so it's not a yes, no. So with a screening test, which is only giving you a risk score, there is no such thing as a false positive because you're not positive or negative. You're just either above a threshold or below a threshold. So there are no false positives with early first trimester screening, EFTS. It's very simple. It's either you screened positive or you screen negative. So let's just take a number and use it as an example. If you get a screening test, we should do a video on this, by the way.
It sounds like it's a great topic.
It is a great topic. So if you get a number that says your chance is 1 in 10, then that means that you still have a 90% chance that your baby is normal and a 10% chance that your baby has, let's say, Downs if you are 1 in 10 for Downs. If you get a 1 in 200, you're still going to screen positive because it's over their threshold, but you have a 0.5% chance of the baby having a problem, which means you have a 99.5% chance that your baby is perfectly fine. What we do in Canada, at least, is after you get that initial screen, if you're positive, like you're over the threshold, they then go ahead and do the non-invasive prenatal test, which is where from the maternal blood, you can, like blood in your arm, we just do a standard blood test, you can find fetal DNA, and then they can analyze that DNA, and they can tell you with a much higher degree of certainty, it's now 99.99% accurate, whether or not the baby has Down syndrome or not. Even then, there can be an error rate, depending on who you believe as high as 10%, in which case you then have to go and do an amniocentesis for confirmation. But generally speaking, if you're told that you do have a problem, you likely have a problem. But with the early first trimester screening, the nuchal translucency, it's not a false positive, false negative. It's just, here's my score, and you may screen positive, but again, that doesn't mean your baby has a problem. It just gives you a percentage chance that the baby has a problem. So a percentage is not a false positive. It's just a percentage. So as far as how accurate is it that you have a 1 in 10 chance, it's going to be really accurate that your chance is 1 in 10. Because if you lined up 10 women with exactly the same values as you, one of them is carrying a baby with Downs and the other 9 are not. And that's how that number is derived. So basically, it's very accurate, but are you that 1 in 10? You won't know unless you do follow-up testing. So hopefully that explains a very, very good question. And feel free, by the way, to ask us gynae questions or obstetrical questions. I actually practice full obstetrics and gynecology. So if you have questions you want to know about pain or periods or endo or PCOS or just pregnancy maintenance, we're always happy to answer those too.
I have 3 genetically normal one 5AA, one 4AA, and one 4AB. Which to transfer first?
One 4AA and one 5AA?
5AA, 4AA, 4AB.
5AA would be your best embryo. So that's the one you should transfer first, then the 4AA, and then the 4AB.
That's what I thought.
That's what Tarek thought too. So we've got a video on that. God, it's probably about 4 or 5 months ago, looking at which embryo grade is your best embryo. So it's on our YouTube channel. So check that out there. And we go through which grade pre-freezing and which grade after thawing is the best. But overall, 5s are the best for that.
Trying to lose weight by eating well. Is it okay if
don't start
FET
with a Chick-fil-A dinner?
That's the cookie that did it.
It was the cookie. Okay, that Chick-fil-A cookie was the best cookie I've ever had in my life. Yeah, so trying to lose weight.
Is it okay to doing an FET soon?
Ooh, well, it depends on how much weight you're losing. So there is a philosophy out there, a theory, that because we all store toxins in our fat, that if you're very rapidly losing fat, you're actually driving the toxins back into your bloodstream where they can circulate for a while before your liver and your kidney can process them and get rid of them. So in the environment of a high amount of toxins in your blood, that's probably not an ideal time to get pregnant. So if you're trying to lose weight gradually, it's probably fine. But if you're trying to lose weight suddenly, 20 pounds in 2 months, 3 months, that kind of thing, that's a lot of weight loss right before an FET. So if you can afford the time, I would stagger that out enough and maybe work with a naturopath or a traditional Chinese medicine specialist to kind of detox your body as you're going through your weight loss, because that might allow for it to happen more quickly. But that is not something that we ever get trained for. In fact, we are probably notoriously ignorant of that kind of thing. And that's why I collaborate with TCM practitioners, with naturopaths, with homeopaths, so that we can get you the best care possible. Even when it's not traditional Western medicine, I'm still a believer, but it's something that you need to really look at with them because they're the experts in that kind of thing.
Hey, doc.
Hey, patient.
Hey. Thoughts on success rates for IUI versus femara plus trigger shot?
Oh, tough question to answer because I need to know what the problem is. So if you have, for example, male factor, the IUI is going to make it much better, probably 10 to 15%, as long as the male factor is not severe. And that's with the letrozole, like femara, the trigger shot, and the IUI. By contrast, if you're just doing femara and trigger shot for, let's say, PCOS, femara alone without the trigger shot, 6 months is a 27.5% chance for women with PCOS. Adding an IUI would still bump that up probably to 10 to 15% per try. So it'll get you a little bit further ahead. In contrast, if you have unexplained infertility, doing femara with the trigger shot is useless, but doing femara, the trigger shot, and the IUI is actually helpful. It will get you about an 8 to 10% success rate if you have unexplained infertility. So that's a reasonable approach, but I need to know more details about you to give you the actual numbers for you and to be able to tell you whether you need the IUI with it or not.
Low egg quality, sperm count. Is medicated IUI with gonal F or letrozole better, plus trigger?
Well, it depends on how low the sperm quality is. And it depends on what you mean by better. Better than IVF? No. Better than IUI? I mean, doing the shots is better than doing the pills. Doing the pills and or shots with the IUI is better than doing the pills or the shots alone. Doing IVF is better than any of those. So it's kind of like a ladder. You've got your first step is going to be entry level, which is pills. Your second step would be the pills with the shot. Then it would be shots. Then it would be adding in the insemination, and then it's IVF. So that's the gradation, and that's going from lowest success rate to highest success rate.
Hey, Dr. V, I have thyroid antibodies,
Okay.
and you have recommended selenium and inositol.
Yep.
Question.
Yep.
Do I need both Dchiro and Myoinositol, or one or the other is fine?
No, just use them both. Even in the most pure of samples, there's probably some contamination anyways. So we just use both. There's nothing wrong with both of them.
We have been trying now for 4 months to get pregnant.
Okay.
Not successful.
Oh, I'm sorry.
Any suggestions?
Oh, wow. Natural conception. So no smoking, no drinking, no drug use. Sex every day or every other day the entire month. I need to shrink down. The camera just dropped about an inch or two. So sex every day or every other day. Make sure that you are taking lots of vitamins. So vitamin D, your prenatal. Make sure you're taking melatonin if you want your very best chance. Lots of antioxidants. Your partner also no smoking, no drinking, no drug use. Keep the testicles cool. Yeah, those are the basics for getting pregnant on your own. Stay positive. Don't bother checking your temperature. It's a waste of time and it just drives everybody crazy. Try and relax as much as possible. I don't tell people to relax because it's obviously very frustrating, but relax as much as possible because the more stressed you are, the lower your chances of success. So keep that in mind as well. Don't have a real sugary or high fat diet. Make sure that you're eating pretty healthy. Exercise, that makes a difference too. Those are the basics.
Is fresh or frozen embryo transfer more successful?
Well, that's a big controversy. So my belief is that the majority of the time frozen is better. And there's good evidence for that. And even when it's not better, it is safer. But there are instances where fresh can be better as well. So for example, if you have a very weak very weak ovaries, and you only produce one egg, and we do natural cycle IVF on you, there's absolutely no rationale to freeze that embryo. In fact, if anything, it wouldn't make any sense. So in those instances, it makes more sense to do a fresh transfer where possible, unless the patient's cycle is off or their lining isn't thick enough or whatever the case is. But if your lining is good, everything else is good, you've made one embryo and there's only one, your estrogen levels didn't go really crazy, your progesterone levels are good, yes, of course, a fresh is better. But if you have multiple embryos available, it usually means that your estrogen level has gone quite high. If your estrogen level has gone quite high, there is no question that that likely has a detrimental impact on doing your embryo transfer fresh. And there are definitely higher risks to doing embryo transfers fresh in terms of smaller babies, IUGR, babies that are born prematurely are higher, preeclampsia risks are higher. So there are some risks that go along with it. No one has quite yet done the perfect study to figure out which one is really the best. We're still waiting on that, but I'm sure it's coming one of these days. So they'll figure it out. The last study I read from about a week or two ago basically said what I'm saying, which is that it's not indicated to do frozen embryo transfers in all cases. There are some people that benefit and there are other people that don't. And so I always advocate on the show and in real life for non-cookie cutter medicine approaches. So if you go somewhere and they say, all we do is frozen, they don't know what they're doing. And if you go somewhere and they say, all we do is fresh, they definitely don't know what they're doing. So you need to always make sure that your case is individualized. It's only by custom tailoring your care to you that you're going to get the best success rates.
Can you grow a 3-centimeter cyst within a month from no cyst to 3-centimeter cyst in the next ultrasound?
Yeah, I mean, if it's a month span, sure, because that could just be your egg. So it doesn't necessarily have to be a cyst, although some cysts can be very rapidly growing. So it depends on what the cyst is. But yes, it's definitely possible.
2 previous losses with abnormal NTs.
Okay.
Now 12 weeks with PGTA tested and NT is normal.
Awesome.
Given past history, should we do amnio to confirm? No issue.
No. If you have a negative PGT and your nucleotranslucency is also normal, there's absolutely no reason to jeopardize the pregnancy because amnio has a 1 per 200 risk of loss, and you do not want to endure loss after finally getting pregnant and having a normal baby. So no, you do not need that. Can we guarantee you that the baby is normal? No. So I don't want to get in trouble legally here. No one's going to guarantee you. I am not going to guarantee you that. But would I advocate for you doing testing? No, I would not. I think that that's very high risk. That's unnecessary compared to the chance that the baby is abnormal with a normal NT and a negative PGT or a normal PGTA. So I would not advocate for that. You might want to do an NIPT test. That's reasonable, but certainly not an amnio. No one would advocate for that without a positive NIPT for something.
Does a thin uterine lining impact IUI chances?
It does. Yeah, you still have to have a reasonable lining even for an IUI. Yeah, it's not quite as important as IVF because there's more time before the embryo implants. So you still have 4 or 5 days after the IUI before the embryo is actually going to stick. Whereas with IVF, like we need it ready at that time. But it does have an impact. So if you're really thin 5 days after, that's going to be a problem.
Is Unisom and B6 safe to treat nausea in early pregnancy?
I don't know what Unisom is. Should we look up Unisom?
Unisom.
Let's look up Unisom. B6 it's part of diclectin. I wonder if Unisom is the US version of diclectin.
I think it's safe.
Sleep tabs. Doxylamine. Yeah. Doxylamine is in. Yeah, it's totally safe for nausea and for sleeping. Yep.
It's an American thing.
Doxylamine. Yeah, it's doxylamine. It's totally safe. There's nothing wrong with that. You can use it. Yep.
Feel free.
Feel free.
I'm very excited to be on the show today.
Well, we're very happy to have you on the show today.
Hi, Dr. V.
Hello.
My husband's sperm DNA frag results were good.
Okay.
4.5 days abstinence. But IUI wash results were poor. 2.5 days abstinence.
Okay.
This happened in 1 week gap. How is this possible? So disappointed.
It depends on what he did 3 months before. So keep in mind for us as males, when we are ejaculating today, then we made the sperm or started making the sperm 2.5 to 3 months ago. So if he was drinking heavily on a weekend and 5 days before that he wasn't, you would see that impact 3 months later. So that could be where it's coming from, if he was exposed to heat, if his diet was poor, or whatever the case is. So it's kind of like a day-to-day process. So for guys, it is really important that you maintain your health. So weight loss, healthy diet, no smoking, no drinking, no drug use, which is a huge issue with a lot of guys. They just don't get it. So all of those things are important. Ejaculating frequently. I get a lot of people that say, oh, I'm tired and I just don't feel like it. And, by the time I get home from work, I just want to sit down and have a beer. Well, instead of sitting down and have a beer, chase your wife around the house. So that's, I got Tarek vigorously nodding yes.
I approve this message.
I approve this message. So I think that's really important for the guys. You got to live healthy and be healthy, right? So that whole thing kind of goes in together.
I was recently diagnosed.
I am Tarek Ibrahim, and I approve this message.
I was recently diagnosed with a complete HLA DQ Alpha match with my partner.
Yes.
Can we still have a successful FET with the appropriate immune protocol?
Yeah. So it depends on who you ask. So I looked this up, and I've had this discussion with a couple of people lately because Fertilization has started doing DQ Alpha testing, God help me. And so all our patients are showing up with either full or partial DQ Alpha matches. So here's the problem. There are only 2 studies on this in the literature. The one study literally says it's like the worst thing ever in fertility. Everybody miscarries or fails. It's not going to happen. The other study said it does not make a speck of difference, and there's no value to this whatsoever. So I'm completely stuck because there's only these two studies and they're literally polar opposites. There was no middle ground. Talking to a reproductive immunology colleague, it does look like they're finding some benefit to using the immune protocols, in particular lit therapy. So that might be a reasonable approach to this, and we will be using immune protocols in our patients who show up with partial or complete DQ alpha mismatches or matches to make sure that they're getting the best that we can offer them.
Hi. Is Clovid cause delay in period? If yes, how many days is normal?
I actually saw that question. Clomid can cause a delay in your period. Typically, women who take Clomid will ovulate on like day 16 or 17. So if you're waiting all the way out to day 16 or 17, it means 14 days later you get your period. So usually like day 31. That lady wanted to know if she should test, but she was really nervous. So go ahead and do your preg test. It's either positive or negative, and it'll be positive or negative now. So it's fine to go ahead and test.
How far are you booking for consults? Getting a referral for you tomorrow from my family doc for a second opinion. I'm a local patient.
Couple of months. So it depends on the urgency, how old you are, what's going on, what you've done and what you need. But we try and get people in as quickly as possible. I won't lie, I pretty much work 24/7, guys. So Saturday at my cottage, I started at 9 a.m. and I finished all my consults at 7 p.m. and that was on the Saturday. So I'm working all the time to try and fit in as many consults as possible, even when I'm not supposed to be working. But there's only so many hours in the day, and we all obviously have other commitments, whether they be religious or family or otherwise. So I do try and have some sense of balance in my life. I'm about 90% work and 10% balance.
It's a work in progress.
It's a work in progress. We're a little off balance, but I'm trying to get it back to being straight.
When preparing for an FET and after having the Lupron depot injection, I still get a full period. Could this explain why I struggle to get a uterine lining to the ideal thickness?
One more time?
Yep. When preparing for an FET.
Yeah.
And after having the Lupron depot injection,
yeah,
I still get a full period. Could this explain why I struggle to get uterine lining to an ideal thickness?
No, I mean, if you're taking your Lupron on day 21, you're supposed to get a period. So the Lupron has nothing to do with it. Now, if you are particularly sensitive to Lupron and it's over suppressing you, that's a different story. But normally, if you're taking the Depo Lupron, just cycle day 21 of the preceding cycle, it shouldn't be interfering with your lining. Yeah, especially if you're taking letrozole after or taking estrogen supplementation, your lining should grow quite reasonably.
At what point is the laser assisted hatching done at your clinic? Before freezing, the day of transfer, etc.
Yeah, so in my previous clinic, our embryologist used to do it before he froze them, but I think that's really not that in favor. And so our current embryologist does it on the day that we are doing the transfer. So she finds that that's the best time to do it because it's right around then that they're hatching, and that gives them the best chance with the least amount of time spent exposed, because you are drilling a hole through the shell of the embryo. So I think she likes doing that right before we transfer so that the embryos are not in any kind of artificial or abnormal status in their environment compared to what they'd normally be like.
Does herpes affect pregnancy chances and chances of affecting the baby if one gets pregnant?
Good question. So herpes simplex virus 1 and 2 are not shown to cause a problem if you have them for getting pregnant. If you don't have them and you get it while you're pregnant for the first time, it is an absolute disaster for the baby. And if you have an outbreak when you're delivering, you cannot deliver vaginally, because if the baby picks up herpes on its way out, it will have herpetic encephalitis or meningitis, and that is potentially deadly and very, very harmful to a baby. So you must have a C-section if you have active lesions or an active infection. And if you get herpes for the first time while you're pregnant, it is very, very bad for the pregnancy. Now, there is human herpes virus 6, which has been implicated in recurrent pregnancy loss and recurrent implantation failure. That's a different type of herpes. And if you have that, it does appear to have a negative impact on getting pregnant. But the genital herpes or the cold sore herpes, which are types 1 and 2, they do not appear to have a significant impact on allowing you to get pregnant. 6 does, but not 1 and 2. I'm sure no one started with
No. that was my own ad lib there. I'm 45 and had 1 failed IVF.
Okay.
Today, 5 embryos, grade A, were put on. The implantation failed. Nevertheless, happy I made it that far. Would you say there is something right because I reached that point? AMH 0.7.
And she had 5
embryo grade 5s.
5 grade 5 embryos? Okay. So if you're making it to day 5 at 45 with 5 embryos, you're doing way better than most 45-year-olds. But I need to know what the genetics were, because about 90% of your embryos will be genetically not normal at 45, maybe even more. So even if you have 5, it's possible that none of them were normal. So on the one hand, it's great that you're getting that far. On the other hand, we don't know if what you're dealing with was normal or not. So the grade is not nearly as important as the genetic, normalcy, or whether or not they are euploid embryos, meaning they have a normal chromosome complement. If you have 1 or 2 or 3 genetically normal embryos, you have a very good chance of getting and staying pregnant. If you don't have those embryos, it's going to be difficult for you to get and stay pregnant, for sure. Difficult or even impossible.
Is it a sign of concern if an RE only checks lining versus ultrasound and doesn't check progesterone via blood work, also when preparing for an FET?
Some places don't. We do. We're really careful about it, but not everybody's checking progesterone levels. So I'm not going to go out there and claim everybody else is making a mistake, or making a mistake. But I think that realistically, you don't have to. If you're confident with your protocol that it's always going to fit every single patient and no one needs adjustment, then no. But for us, I mean, we're constantly advancing things. So we just added in matrix ultrasound technology to our program, which we're trialing for a while at no cost to our patients. We're actually paying for it to see if it will improve our outcomes. And that's a special ultrasound technique where you can tell people if their lining is good enough to go ahead and do a transfer or not. So we'll see. I mean, we got a really low score today in someone where previously she got pregnant with a lining that looked worse than the one it did today. So we'll see what happens. We're going to go ahead because she wants to, and in other people, we may back off. So, we're constantly about making sure it's customized, and we do everything we can to specialize on focusing on you. Some centers just kind of have a more cookie cutter approach, and I'm against that myself, but you got to decide what's right for you, and the center has to decide what's right for them. Look, if it's a center that has a cookie cutter approach, but they're consistently getting an 80% success rate, well, then you can't really argue with them, right? So it depends on what their success is with what they're doing. Are there like a million questions again tonight?
It's a good thing we started
early, right away.
Yeah.
Okay.
Yeah. Are any anxiety meds safe while doing IVF FETs?
All anti-anxiety meds that are selective serotonin reuptake inhibitors, SSRIs, have potential fetal risks, in particular in regards to lung and heart development. So if you don't need them, we strongly advise you not to get on them. If you need them, you need them. And keep in mind, your mental health is really important. I never want to compromise anyone's mental health. So if you need them, you need them.
How long is the wait for funded IVF?
In our program, forever, because we don't have any funding and we are just waiting for other centers to give us some. So we only got a handful this year. We get a handful each year. We are very hopeful that the government will give us funding sometime in the near future, but we don't know yet if they're going to do that or not. So, you know, if you're local, write your MPPs, write the, you know, premier, write the Minister of Health, tell them Windsor deserves funding, because we do. Windsor, Chatham, Leamington, Essex, Tilbury, and Sarnia. You know, all of those areas all deserve to have funding, and they don't, but we're trying to get it. We just haven't heard yet.
I'm using donor egg of a 25-year-old who has donated previously.
Awesome.
She has had several pregnancies and a live birth with her previous donations.
Okay.
Should I PGT test the donor embryos?
No. So we've got a great video on that. It is not necessary. I actually just sent it to someone. When was that? Yesterday or day before yesterday. So yeah, you do not need to do PGT on a 25-year-old's embryos. At 25, the chance that the embryo is genetically abnormal is probably around 25%, maybe 30 at most, but probably realistically much more like 25%. So if you have a 25% chance of genetic normalcy, it means you're biopsying 4 embryos to find the one that's abnormal. That's 4 embryos being tortured for one to be found. It doesn't make mathematical sense, statistical sense, anything like that. So we do not advise for that. I always relay this great story where we had this patient that came to us and said, it was in my previous fertility program, and she had gone to 2 other centers. She tried her own eggs, then she tried a donor egg. She even tried a surrogate. It didn't work. And I said, well, what happened? And she explained, and she said, I even had the PGT tested. And I said, donor embryo, like donor egg, why would you get PGT testing? She said, they told me I needed to do it. I said, well, that's ridiculous, because you're just harming the embryos. And so we made her new embryos with the donor. We put the embryo into her, and she got pregnant with twins. So everything was perfectly fine, and she didn't need anything. Yeah. So don't do PGT if you're less than 38 realistically, or there's a list of other problems like we said at the start of the show.
With chemical pregnancies, do change any medications for the next time? Had a natural cycle, wasn't on any fertility meds, this cycle just vitamins and supplements.
It depends. I mean, just one chemical pregnancy, no, but if it was recurrent, sure. You can always add progesterone and aspirin. They're harmless and probably helpful, but you don't need anything fancy with just one chemical pregnancy. If you have recurrent chemical pregnancies, that merits investigation.
Hi, Dr. Victory. Is it possible to freeze embryos created from frozen egg? Does it harm them?
Yeah, it's done all the time. Like loads of people that buy frozen eggs or froze their eggs themselves and then come back to make embryos. If you froze 20 eggs, you're not going to, use 20 embryos. If you end up with that, you won't. But even if you end up with 10 embryos, you're not going to use all of them in one go, right? So you have to refreeze them. Is it ideal that we have to do that? Certainly not. But is it doable? Of course. Yeah, it's not a problem. We can do it.
What would be the reason that PGT normal embryos results in chemical/failed transfers?
Well, that's a great question. And the answer is nobody knows. But there would most likely be either paternal problems, meaning it's a problem with the dad's sperm, or it could be an egg quality problem. You can have a genetically normal embryo, but have it be energy inefficient, or have a single gene defect, which causes the whole thing to kind of fall apart. Without having a chromosomal defect, you can still have gene defects. And then there's the whole slew of other things. So is there a thrombophilia where your blood clots too much? Is your immune system overactive? Are there infections? Is there endometriosis? Is there fluid in your tubes? Does your uterus have polyps or fibroids? Are there hormonal problems? Do you have thyroid antibodies? So there's like a long list. I'm just kind of skimming the surface there. but there's a long list of possibilities for why a genetically normal or euploid embryo would not implant. I take those cases very, very seriously. Even after just one failure, I offer patients investigations because with us, it's pretty unusual that you will fail unless something is wrong. So we like to go looking for what it is pretty quickly, maximum 2. If I do 2 euploid transfers and we have not been successful, even 2 unknown transfers, we start looking for answers.
What are the chances of a PGT tested embryo implanting?
Well, it depends on who you're working with and what your age is, but anywhere from like a low of say 40 or 50% to a high of 70. So depends on what protocol they're using and what your general health is and so on, but they're very good chances.
Is the reason why some patients take fragment injections and others don't?
Well, there's 2 reasons. So one is if you actually have a known blood clotting disorder, thrombophilia, then we use fragment, or you've previously had a blood clot, because your risk of having a clot in pregnancy is much higher. The other reason is for the people that have either unexplained failures or they have a condition which requires a fragment, like antiphospholipid syndrome. And so in those circumstances, many of us will turn to using the blood thinners because we believe that it increases the success rate. So I do use heparins when we have unexplained implantation failures because I believe it works, and I've seen it work, so we do it.
If a cycle produces no PGTA normal embryos out of 6, what are the odds of the next one working? 39 years old, sperm issue, skinny PCOS, egg donation time.
Well, I'm hoping you didn't get 6 embryos from an egg donor that were abnormal. That would make no sense. Excuse me. If they were from you at 39, that's unusual. It's not unheard of, but it's unusual. So I think it's more of a financial decision than a medical decision. From a medical standpoint, of course, you're going to have a much higher success rate with the donor. But from a financial standpoint, if you could afford to do it again with you should be successful after a second try. So I would be advocating for that. I got no trouble with that. So I try again, and then if it didn't work a second time, yes, I would probably tell you to go to donor. But there's no reason why you should have to jump to that after just one try. You should have a good chance. So on average at 39, about 70% of your embryos, depending on who you listen to, maybe 80%, will be genetically abnormal. Go to our YouTube channel, find the embryo math video, make sure you push subscribe and click like, and then watch that video, and you will see in there lots of graphs that show worldwide data that I lifted right from their papers, where it shows you what your chances of having a normal or an abnormal embryo are. And then it helps walk you through the math so you know how many times you'll need to try and what your chances are.
Can curcumin thin lining?
Oh, I've never heard of curcumin thinning the lining. Not to the best of my knowledge, no. That's another one to look up, I guess. Yeah, curcumin and endometrium is used for endometriosis. So well, it inhibits endometriosis. We know that. Oh, I don't know what I just downloaded. This might be scary. Inhibitory effect of curcumin on angiogenesis and ectopic endometrium of rats with yeah, that's not going to help me. Not that I'm aware of, but it does have anti-endometriosis effects. So can it potentially thin your lining? I mean, if it has anti-endometriosis effects, it could have an anti-endometrial effect as well, but I'm not aware of anything that says that.
I'm hoping for a transfer. I have been on Lupron for over a month and no period. When will I see a period? Is this normal? Can one move forward without a period?
So it depends on whether you took the 1 month or the 3 month version of Lupron. You may not get a period. It's normal not to get a period on Lupron, and you don't need a period to continue. So that's perfectly fine. They can stim you without that.
Hi, I take vitamin D drops with vitamin K. Should I stop at any point around retrieval or transfer given that vitamin K coagulates blood? Thank you.
Vitamin K doesn't coagulate blood. Vitamin K is necessary for your blood to coagulate. Yeah, you probably should not be taking vitamin K around your retrieval because as your estrogen levels go up, it could make you prothrombotic. So the vitamin D is fine, but don't take vitamin K at the same time near your retrieval.
In my letrozole cycle, I had 4 follicles on CD11. One was at 19 millimeters and 3 at 12 to 13 millimeters.
Mm-hmm.
What can I do to make sure that next time is at least 2 follicles grow at a good size? Is injectables along a good plan?
So there's nothing you can do naturally with just the letrozole aside from up your dose. Adding in shots would help. You got to be careful though, because if you made 3 more that were in the range you were referencing, you could end up with too many eggs. So that could be a problem for you. You managed that one without dropping the camera.
Sometimes I do magic.
Yeah, so you can use shots, but just use like a smidgen, like 25 units or 50 units or something like that. Don't go crazy with the shots. We're winding down the clock, 3 minutes.
You are winding down, sir.
Do we still have a ton of questions? It's a crazy night. Yeah.
Yeah, it's a good
Thank
night.
you guys, by the way, for making the show bigger. It's getting bigger and bigger every week. So we appreciate that you're telling your friends, and feel free to go out after the show and tell everyone that you had a good time watching.
Have a good time reading.
And Tarek had a good time reading.
I'm a month into my 3-month suppression with Lupron and letrozole. I feel like my endo pain is worse than ever, even before my laparoscopy.
Really?
Last U/S ultrasound shows no endometrial mass growing yet. Why could this be?
I have absolutely no idea. That's highly, highly, highly unusual. It is not common for people that take Lupron to have worsening of their pain. You should be seeing your gynecologist. Yeah. Or RE, but make sure you see whoever it is to figure that out. It's not typical at all. That's the opposite of what should be happening. Interesting.
Hi, Dr. V and Tarek.
Oh, and Tarek. He's super excited about that.
We have our FET Friday, and we are so excited. Just want to say we are so happy to have the best care here in Sarnia. Loves.
There you go. Well, thank you for acknowledging Tarek, and congratulations. And we're super excited to help you out. So we'll look forward to it. Our success rates have been just absolutely mental. So we've been super happy about how many people we get to help. So it's been great so far.
Thank you for doing these lives.
You're welcome. Yeah, actually, you know what? Today I saw one of our patients. I think she actually was our very first egg retrieval. She's either our first or our second egg retrieval. And she failed actually her first 1 or 2 transfers, and she's pregnant now, 12 weeks. So I was super excited to see her today. So yeah. You know what? If you try hard enough and you do all the right things, sooner or later you get there. So we've had very, very, very great success here. Very excited about that.
Would you recommend any alternatives to trying to do an egg retrieval on a 36-year-old going through menopause?
Well, if you can still make an egg, your options are help making eggs and then just have natural intercourse, help making eggs and do insemination, help making eggs and do IVF, or use donor egg. Which of those choices you choose is up to you. I gave those to you in order of success. So helping you make eggs, probably not going to be very successful, single-digit percentage. Helping you make eggs and doing insemination, unfortunately, same thing. Helping you make eggs and do IVF, we just had a lady around your age that we just made her make 1 egg, and she's happily pregnant now. So that's doable. And then using donor eggs is a slam dunk, basically. So you have lots of options. Just choose which one you think best fits you medically, emotionally, spiritually, financially, psychologically, all that stuff.
Hey, Dr. V, how was Chick-fil-A?
Chick-fil-A, you know what? We were discussing this. Okay, so I want a show of hands here, okay? I need to know how many people love Chick-fil-A.
Oh, you want this?
I want to. We got to put up like a poll. You know what? We need like a live online poll. Can we do that
on YouTube? You can do that.
Can you do like a live online poll? Let's do a live online poll. So you know what? I never had it before, so I'll tell you what we had because it was like absolutely horribly unhealthy. I hope my daughter is asleep because she's gonna kill me. Okay, so I had the deluxe chicken sandwich with cheese.
That's a Canada only thing, by the way.
Oh, is it? Okay, I had the Canada only deluxe chicken sandwich with cheese. First couple of bites, I'm not gonna lie, it was a great chicken sandwich. And I had their own special sauce on it. By the time I got to the end, I was like, it's a chicken sandwich. The fries, I didn't like the fries. Do you like the fries?
I like that waffle thing.
Really? Yeah, the fries didn't do it for me. The chocolate chip cookie, hands down, best chocolate chip cookie I have ever had in my entire life. The chocolate shake was good. I didn't think it was amazing, but it was good. Yeah, you too? You had cookies and cream.
I had cookies and cream, a whole different thing.
Sweet.
It was sweet.
Yeah.
It is sweet.
We're both on
it is sweet.
Like we need insulin. Man.
Now I can't eat for 3 days. That was my meal for the day.
Forced fasting, yeah. It was good. The Chick-fil-A was okay. Would I go rushing off to get it again? No. Would I wait in line for an hour to get it? Definitely no. But it was good. I enjoyed it. I would eat it again.
It's a chicken sandwich.
It was good. As Tarek said, he said, you know what? As far as the chicken sandwich goes, it's not elevating the chicken sandwich to something it already isn't, but it's a damn good chicken sandwich. So you know what? It was a beautiful summary.
That's exactly my review.
I am Tarek Ibrahim, and I approve this message. That's really funny. It was good. Okay, one more?
902, yeah, sure.
All right, one more question. Oh my God, there's that many? He's still scrolling. Wow. All right, Tarek's terminal question.
All right, you know what? Here, we'll go with this.
Okay.
This patient seems serious.
Okay.
They're all serious, but
they're all serious. Yeah. This one's extra serious.
Yeah. Hi, Dr. V. I've lost almost 50 pounds.
Wow.
I've plateaued.
Okay.
No weight loss in the last couple of months. I'm at less than 1,500 calories and 1.5 hours of strength cardio daily plus vitamins.
Okay.
Any other suggestions?
Well, first of all, the question is how much do you need to lose? You may not need to lose anymore, in which case don't try to lose anymore. And then look at your supplements and focus more on strength rather than focusing on cardio. Because cardio doesn't necessarily make you lose any more body fat. And also don't forget that your weight may not be changing, but you could still be getting leaner. The more muscle mass you build, the more dense your muscles are. So they weigh more than fat does. So you can literally be losing fat, gaining muscle, and increasing your weight because the muscle is denser and therefore heavier than the same volume of fat. So don't get bogged down just in a number. Look at the overall well-being, your endurance, your fat composition, your the body fat percentage, what's happening with your metabolism, what's happening with your blood pressure, your heart rate, all of those things. Don't get discouraged because you can't lose more weight unless it's definitely still fatty tissue, in which case there are ways to continue losing more fat, but you have to increase your muscle mass. That's the only way to do it. So I think that's it, right? That's a good point to end the show. So thank you guys. Really appreciate you joining us. I am Dr. Rahi Victory. This is Fertility Factor Fiction. Thank you, as always, to Tarek Ibrahim from Ibrahim Strategies Group. And we will look forward to seeing you next week. Next week, I think I'm going to pick an article on a Chinese medication that can thicken your lining. And we'll probably do a whole review of what kind of things can thicken your lining, because it seems to be a running theme. So we'll maybe do a whole video on that. Have a great week, guys. Take care. And if you're in any one of the states or Toronto where they got an absolutely enormous dump of snow, please stay safe and be careful out on those roads. Okay, guys? Take care. Have a good